Welcome back, everyone. Let's continue with the remaining portion of the chest pain, which we started with the types of chest pain and their severity and location. And all those who have missed it can go to part one and go through the rest of the slides. Okay, moving ahead, let us understand the risk factors which are associated with cardiac chest pain. Here, there is no business of non-cardiac pain. We will be talking about the risk factors of cardiac diseases, basically, because it is very important to know this since these are modifiable. What does that mean? We can change them, we can reduce them so as the plaque which we were talking about, the blockade portion can at least stop progressing or at least regress, stop there or regress. Okay, so the most important ones are hypertension, which we say high blood pressure, diabetes mellitus, which is commonly called as sugar. These two diseases are very bad. Okay, although they have become very common, India has become the diabetic capital of the world. We know that the volume of these diseases is going high exponentially. Okay, but still, the treatment, the control is all in our hand. And you will be surprised to know that if we have these two diseases, the chances of having heart disease becomes 2 to 4-fold high. Okay, so it is very, very important that we understand that these things can be controlled, and by controlling them, you will reduce your risk of getting heart diseases. Next is dyslipidemia, which is high blood cholesterols. And as we have already discussed earlier, the cholesterol gets deposited in the walls of the arteries of the heart, and not just heart, but in the kidneys, in the brain, or anywhere in the body. Okay, so this leads to narrowing and various other symptoms. Next risk factor is genetics, which we often say, my genes are such, my genes are like that. Okay, so what do we understand by that? We will say that your genetics is more prone for heart disease when some male in your family from your maternal side or your paternal side has suffered from a heart attack less than 55 years of age, or a female has suffered a heart disease less than 65 years of age. Okay, if someone has undergone a heart disease, maybe a male at the age of 60 years, we generally don't include this in the as genetics, as genetic predisposition or genetic tendency. Okay, that is something age related. So genetics, we understand, is non-modifiable. Okay, but then we can take care by regular evaluations, by letting other risk factors not get into you. So this is the importance of knowing what your genetics is. Next is obesity. Okay, weight gain, mainly abdominal girth, means the size of your abdomen, your belly. The belly fat is the worst fat in your body. So take care of that. Don't let obesity set in. And we all know, good diet, exercise, yoga, pranayam, all these things, the control all the risk factors simultaneously. So not just one thing, everything is targeted by these few magical words. So generally we say that waist girth of 94 beyond is bad in males, and 80 or beyond is bad in females. Smoking. Next factor is smoking, and smoking is such a terrible factor that this is as bad as hypertension and diabetes. Most of you must be knowing that smoking causes lung cancers, but no, it is equally bad in causing heart diseases, right? So tobacco in any form is bad. You need to stop it. Then sedentary lifestyle. You are exercising in the morning, you are walking in the night, and then the whole day you are sitting on the bed, okay, watching and eating in front of the TV. So this is not good. People don't exercise, people don't move, people don't work. So these all things, lead to hypertension, lead to high blood sugar, and eventually a heart disease. So one should focus that, and you must have heard about the fact that everyone should walk 10,000 steps in a day. So these 10,000 steps are not to be covered at one go. You may divide it throughout the day. If you can't walk much, walk slowly. Nobody asks you to walk briskly, but do walk, do move. Every hour at home, you can keep moving for a few minutes. Okay, then if you keep walking for 5 to 10 minutes every hour, see, in 8 hours, you will complete 80 minutes. So this is how you have to see. We can keep giving excuses that I can't walk, I have knee pains, I have this, I have that. But see, eventually, if you don't walk, all these problems will keep increasing. They will not decrease. So movements are very, very essential. Next is sleep apnea. This is a very important term and very important diagnosis, which everyone should try to see in themselves or their partners to prevent heart disease. Those people who are suffering from this disease have very high propensity of getting heart diseases. Now, what is this? Generally, during in this sleep apnea, the person at night or when he's sleeping snores badly, we know that, and suddenly, his breath stops for a while. Okay, he's not breathing actually. So apnea means stopping of breath, which he doesn't even know. So suddenly, he becomes breathless. He gets up, and he suddenly is startled that what has happened. We don't even come to know about it. Okay, because the person goes back to sleep. This generally happens with people who are obese, means fat. They have short necks, a lot of fat here in the neck, and so this can be detected very well in time with the help of sleep studies. The most important thing is the awareness of this disease, or of this symptom, by the partner or by the person themselves. They'll keep complaining that they are sleepy or drowsy the whole day because they are unable to sleep at night. Okay, so if this thing is prolonged for a long time, so you may have a high risk of having heart disease. So be aware of this and get yourself evaluated. Then last but not the least, it has immense role in having heart diseases. This is mental stress. Okay, we all are undergoing a lot of mental stress for petty things, for big things. Okay, so the idea is that this can be the precursor of all the above said risk factors, right? Sleeplessness, insomnia is inability to sleep. When you are stressed, when you are not taking proper care, when you are on a lot of media at night before sleeping, you're sleeping full stomach. Okay, all these problems, they lead to sleeplessness. So one should focus that a person gets adequate sleep. Adequate sleep means a sumptuous sleep, and for adequate hours. At least 7 to 8 hours of sleep per day is very, very essential. People generally say, doctor, I will not take a pill. It may harm me, in the future. Then I say that, do you understand that if you don't sleep, what all you can have? Because you don't know, it is not written anywhere that you can develop high blood pressure, you can develop sugar, or a lot of negative effects will take place in your body. Are you aware of that? No, you are just aware of the fact because the side effects of medicines are written on the Google. So we have to actually weigh a balance, that what is harming you in which way. So having sleeping pills for short duration, the safer ones, the less addictive ones for short duration, may help you induce sleep and reduce your risk factors, right? So do not refrain. I'm not advocating sleeping pills, okay, but it is very, very essential that we sleep well. Now, moving ahead, the slide actually shows that what all can be done to detect your chest pain at an early stage, prevent a heart attack. Okay, So there are few tests which are non-invasive and semi-invasive and invasive, meaning you are not going inside the body. Okay, so for that, I generally recommend that everyone should go for an annual ECG. Why is it important? Even though you're not having anything, but at least a baseline ECG is available. Whenever you are having a problem, we have something to compare. And I will recommend here that always get your ECG photocopied. They're generally thermal papers, they get washed away, and we have no clue that how your ECGs looked in the past. So at least keep a photocopy of them, because it is very important for the reference. One more thing I would like to point out here is that 50% of times, even though your ECG is normal, you may still be having heart disease. Okay, so this does not rule out, yes, it is one of the tests. Okay, but when the symptoms are very classical, the doctor will advise you to move ahead with other more specific tests. What are those? So in that, we do echocardiogram. This tells you about the structural aspect of the heart, meaning the valves, how are your valves functioning, what are the pressures inside the heart, and most importantly, what is the function of your heart? How are your cardiac muscles working? Is there any damage in the areas which are supplied by different arteries? So that also gives us a clue that there has been a silent heart attack in the past. If the heart functioning is good, it is a good prognosis, meaning the chances of survival in the future is good. Then comes TMT, which is treadmill testing. In this, we make you run on the treadmill, and the ECGs are simultaneously running on the monitor. So this is kind of putting your heart on stress. So once the heart is stressed, we judge that is there any deficiency of flow supply, blood supply to your heart muscles, and if it is so, the ECGs will start showing that, right? But yes, there are some few percentage, like 10 to 15% cases which are missed on this. Okay, so there is another test called a stress echo, wherein we combine echo, then treadmill, and again a quick echo, right? So the specificity of this test is higher than a pure TMT alone. So sometimes when the TMTs come abnormal, the doctor subsequently advises you to go ahead for a stress echo, right? So in this, we come to know that, okay, there is some territory involved. And then we subsequently go for higher investigations. Then CT coronary angiography, you must have heard, okay? So when there is some confusion in the history that there is a young person, there is a family history, somebody is obsessed about it, or somebody has undergone a bypass grafting in the past and is having some problem, that's where we recommend a CT coronary angiography. Okay, but generally wherein we are very sure from the history, or some TMT is abnormal, or means we have concrete evidence that no, your symptoms and your non-invasive testing indicates towards having heart problems or blockades, it is better that you go for a conventional gold standard coronary angiography, which we do in the hospitals after admission, right? So apart from this, one more message I would like to give you here, which is very important, is that try to keep some handy ECG devices, ECG machines, which are available in the market, which can help you in immediately recording an ECG while you are having chest pain or palpitation or any unusual unwarranted symptom, right? So you cannot be running to the hospital at that particular time, because the commuting logistics come into way. Okay, so I will request you all to go into the description to watch some videos. There is no promotional intent behind that. I just want to, there may be more devices available, but whatever I had and information about, we have loaded some videos. Try to see that those ECG machines are of the size of the car keychains, okay, and very easily held, very easily operated. You can operate it very easily and can transmit the ECG quickly to your doctor through the app. through the WhatsApp. Okay, so keeping these devices at home will help you in identifying the main problem and can also reassure that this is not a heart attack which is evolving, right? So try to see that, and this is not very expensive also, so everyone, and very user friendly. So just try to see that and keep that at home so that this can help us in reaching the diagnosis quickly. Okay, there are few tips I wanted to give. Behind the reason behind the slide is most of us know that we should sleep well, we should avoid constipation, we should regularly do yoga, pranayam, and walks. Okay, so meaning to say that what all can be modified should be modified. Your attempts should be fair. That whatever is in your hands, do that at least. Okay, and drink plenty of water. So when water comes into issue, one should the elderly age group should take in care that your kidneys are functioning well first, second your heart is functioning well. So if there is any compromise, you should check on your water intake or ask the doctor that can you take enough water. Okay, now, the most important, the last, though I have mentioned it at last, but the most important thing is maintaining mental peace by avoiding unwarranted conflicts and arguments. Okay, we find people arguing with the maids, with the there are a lot of car parking issues, fighting with the relatives, fighting on the property, fighting at the banks. Okay, be peaceful. Okay, you may take some more time, you may be agitated by the way maids are not working, but this is taking away your peace, this is raising your blood pressure, this is raising the sympathetic causing so sympathetic overactivity in you. Okay, which is not good for your cardiac health. So just ensure that do enough pranayam and yoga daily, and try to observe peace, right? Don't fall into unnecessary arguments. Learn how to avoid an argument. This will give you a lot of peace, mental peace. Now, this is also a very, very important part of my talk today, because most of us miss this important aspect. We learn that what is cardiac pain. We know, we try to keep sorbitrate with us, we keep disprins with us. Okay, but there are few things we generally miss. So there may be people who know this and who have already tried doing this, but just for everyone's sake, I've tried to brief it here so that the panic button is not pressed. Okay, so what are all these things? One must keep a note of all this, that your medical history should be well organized for immediate access. Okay, we keep doing annual tests, ECGs, TMTs, we know, but nothing is organized sequentially or in a folder. So when we actually need it in emergency, we are like fumbling with the papers, not finding what are the latest. Okay, so that's why the second point comes: most recent prescription and ECG to be with you 24/7. How can we do that? The best thing is to keep it in the mobile. Okay, the last ECG and the prescription, that is always accessible. Okay, we are panicking, is something happens in the night, we can just pick up our mobile and rush to the hospital. Okay, so keep your latest, what all medicines are you taking, what was your latest ECG, what was your latest prescription and diagnosis, because the spouse may not be knowing everything or may not be able to tell. She may panic or he may panic, right? So if you have a history in your mobile, you can immediately show it to the doctor so the doctor can have a clue and quickly start your treatment. Next is coming to the logistics for hospital shifting. Okay, we do not know where to go in case of an attack or in case of an emergency. There is a sudden cardiac arrest, the person becomes unconscious, what to do? You start panicking, and as a result you're wasting time. Okay, so the logistics should be very well planned. One must keep the ambulance and the nearby emergency hospital numbers. very well in big fonts. You should place it near your bedside, in your mobiles, near your entrance gates, so that at night or in a panic, you're able to see it. You can able to tell it to other people who come to your rescue, that okay, these are the numbers, please take us there, right? And the emergency contacts to whom you will contact as the first source if you're not living with your children, or you're alone. So this should come as the most important thing for quickly reaching the hospital. Okay, if you're staying in a condominium, you're staying in flats which have lifts, how will you shift a patient? Whom will you contact? How will the patient be shifted down? All these things should be in your mind, right? God forbid nothing happens to anyone, but if it happens, you should not be wasting time. The idea is all that, right? So your medical kit must have a Disprin, a Sorbitrate, a handy ECG machine, the BP machine, the sugar machine, at least, at the first, when the first aid is required, the ambulance is coming. In the meantime, at least we can do all that, what is in our hands. Okay. So my last slide will tell you about the first aid which we can give to the patient when he's having a heart attack, when you are suspecting a heart attack. Okay. So the first and foremost is, please don't panic. Okay. Because that will not be of any help. It will waste your time and it may worsen the situation. So the most important thing is just lie down, inform someone nearby quickly, maybe your wife, your husband, or any relative or any neighborhood nearby. Loosen your clothes, just lie down, adjust the room temperature so that it is not very cold, not very hot. Okay, lying down is very, very important. Okay, quickly record an ECG if that is possible. If you have an ECG machine at home, record the BP, sugar, drink some water if the person is purely is like appropriately conscious. Do not try to push in water in somebody who is semi-conscious, because that may get stuck into the breathing pipe and may cause problems, right? Then if you have a history of heart disease, or if as I've shown you the kind of pain you are having, so if you're sure that this is a kind of heart attack, there's no harm in taking a tablet of Disprin, dissolve it in water and just take it inside. Okay. If you have an ecosprin, which most of the people know, don't try to take ecosprin, because this is a delayed release aspirin and will take time to dissolve and get absorbed in the body. Okay, try to keep Disprin, right? So don't take ecosprin. Then you can have some antacids also, meaning Gelusil, Digene, like, if there is any confusion or there's any nausea, this will subside with the antacids. Also, sometimes, like, when we are sure the angina is ongoing and the pain is too much, BP is not low, okay, then the doctor advise sublingual Sorbitrate. Sublingual meanings under the tongue. Okay, so you can try twice. We recommend thrice, but then, in the meantime, if one Sorbitrate does not relieve the pain, try to call up the emergency. Try shifting if the pain does not subside in few minutes. And if the most important, and if the patient falls unconscious, okay, one must receive a CPR, which is cardiopulmonary resuscitation at home. Most of the cardiac arrest do not survive if they are not rescued at home. But if CPR is done, 45% chances are there that the person may survive, right? So everyone should learn a home CPR. It is not all that difficult. We just need to learn giving compressions, So we just stand near the patient, and also I've loaded another video of a CPR in the description. So kindly go through that, and you have a lot of videos available in the on the YouTube also but one must know at least 100 to 120 compressions in a minute. Breathing is not essential. Giving mouth breaths is not so essential. But chest compressions is very, very essential. You may save a life if you learn CPR. So I will again emphasize that everyone should learn a basic CPR. Please go through the video at the end of the talk in the description, and that will help you a lot. Thank you so much.